Spiritual needs are commonly enkindled in us human beings when we are hospitalized, both because of the reason we need to be hospitalized and because the experience of being hospitalized itself is quite challenging. Spiritual needs as a concept do not fit easily into today's healthcare culture, which has evolved from the initiation of Hippocrates in 400 BC, separating religion and spirituality from scientific observation and data. Only now are spiritual needs being integrated back into healthcare culture at a very slowly evolutionary pace. In the highly pragmatic and humanistic culture of healthcare, there's need for a language based on understanding of spirituality as realities that are at least partially observable to clinicians in order for them to respect what is happening inside people as they are hospitalized. The human spirit refers in this presentation to the observable liveliness of a person or group. That is only partial, of course. It's the verb, the resilience, or the present well-being, in the sense of one would notice school spirit when you see it, or be able to assess whether a given caregiver is able to raise a patient's spirits or not. So, practical definitions of spirituality and religion would include this one: everything that a person does to cope with and find meaning and enjoy even what can't be controlled. Now those include such uncontrollable phenomena as the natural world itself, which we never control but only influence to some minor degree. Our relationships with ourselves, which we don't obviously completely control. Our relationships with people that feed us all our lives, but we never control. Transcendence, that power beyond that's present in every healing or in every failure of healing, we don't obviously control. And the communities that are important to us, from families to professional associations, that we obviously do not control. You can get more information on this topic on YouTube in a Spiritual Arenas video, or at spiritualclinician.com. Religion is a part of spirituality. It's made up of the evolving wisdom and limitations of spiritual leaders over the centuries, which have influenced us all in one way or another, from which we've developed our own practices and values and beliefs by incorporating some of those from such religious geniuses as Moses, Jesus, Buddha, and Muhammad, and from our own thinking and experience. Religion causes pain as well as being of enormous support to literally billions of people on this planet today. But spiritual need is also caused to some degree by leadership of religious traditions. We define spiritual need here as either a common or crisis situation in which a person has difficulty finding meaning, purpose, and direction when they're facing something that cannot be controlled. In a moment, we'll be describing a 4-axis framework of spiritual needs that are common in healthcare situations. But first, some assumptions.
A few basic assumptions are that all people experience spiritual needs at one time or another. Spiritual needs are not at all fixable. They benefit from genuine care, which begins most always and intends to allow the surfacing of spiritual issues through personal listening. We also believe that the effects of or outcomes of care for spiritual needs can be measured to a degree and thus researched, even though the care itself can't be measured, and that it is possible to identify specific spiritual needs that commonly occur in people challenged by necessary engagement with the healthcare system or hospitalization. We do not claim that this list is at all comprehensive. Spiritual needs emerge most often in relationships in which rapport has first been established, which is made up of careful listening, conveyed empathy, gentle questions, support, and occasional insightful interpreting.
A simple definition of rapport, which is essentially a very elusive concept, would be it's a uniquely engaging relationship in which serious human concerns flow easily between a person who needs and a person who actively cares.
These axes can be organized by 4 primary questions that a clinician can carry with her as she speaks with patients, although not necessarily and probably never asking these questions directly of people, but wondering in the conversation, what does this person need emotionally right now? What major losses has she experienced that may still be problematic? How does she uniquely care for her own human spirit? What are her best ways of doing that? And what does this person need that may be beyond my relationship? In other words, that may call for a referral to some other form of care. An additional question would be, what are the spiritual pathologies? Are they here? And they are there in many people, including addiction to religion. The overall framework is here. Careful listening, rapport on the left, assessing in the middle, and the 4 axis of spiritual needs on the right. We begin with axis 1, emotional support. All people on the planet have anger, they get hurt in their heart, they fear, they get sad, and they have regret. When one of those becomes excessive or huge, intense, distracting from everything else, then it can be called a spiritual need. We describe here 6 emotional support needs. The first is simply the need to talk. Somewhere in the neighborhood of 70 or 80% or maybe more of people benefit from verbally processing what is happening to them when they're distressed in a difficult time of life. Different people have noticed over the centuries that people simply feel better when they talk. On the floor of Harborview Medical Center in Seattle, on the floor of the foyer, is embossed the words, of a Native American leader, Chief Sealth, sharing doubles your joy and cuts your pain in half. Most everyone experiences on some level fear at healthcare settings. We enter that place not knowing what we might lose that may be important, what might hurt, what all we might see that will be painful in there, and what really is happening to us, what will happen when we get treated there. Anxiety differs from fear in that anxiety generally has no real focus, where fear has something that is the object of our fear. We know something about what we're afraid of. Anxiety is a kind of shapeless fear that is carried by some people extensively every day of their lives, and by many of the rest of us at times when we're really threatened with some kind of pain or recurring pain. Most of us are a bit angry on some level too by hospitalization. It disrupts our schedule. It says something is wrong with our body that we just don't like. This kind of anger can also be exacerbated by old anger that has been carried from previous hurts and annoying events that lasted a while or got deeply into us. Sadness lies of a person that's hospitalized generally lies somewhere between being disappointed at the inconvenience, blue, down, discouraged, dejected, defeated, sorrowful, and even suicidal. It benefits at least as often from interpersonal care as it does from psychotropic medication, which it often is caused from people and finally, among emotional needs is the need to find our own best strength, which tends to be dissipated and submerged in a situation in which all kinds of people are around to help us. We often can easily lose our own best charge of what we can do for ourselves and need to be empowered. The second axis of spiritual needs is that of major losses. What has this person lost recently and historically? It still disturbs at times. There are 5 needs in this cluster. The first being current grief. Major loss that's currently happening or has happened in the previous 48 hours or so. There are now hundreds of books written about the grieving process from all kinds of different points of view, perspectives, and styles and disciplines. It is one of the classic spiritual needs. Prior grief is another. Past losses tend to emerge again in hospitalization, where the vulnerability of being cared for and treated is so palpable that it brings up past losses, and they can be cared for a bit more when they emerge. Dying has prompted in the last 40 years or so of the resurgence of hospice and the development of palliative medicine. Powerful spiritual need, maybe one of the worst, in which we're losing everything. And getting used to the new way things will be has to do with life adjustment, when you're going to have to just get used to It's a major change in the way you look and the things that you can do. And finally, and under losses, is estrangement, also more common than many people may think. That is, having been separated from someone you love very much and not spoken for months, weeks, maybe years, sometimes even decades. And the need emerges in hospital sometimes to possibly reestablish some kind of relationship. It can be a deep spiritual need when you're sick or injured. Axis 3, religious and spiritual support needs, includes needs that arise in the area of traditional religion and more recent developments of spiritual modalities. Religion is essentially a collection of all that has been done by various cultures in order to develop practices, perspectives, teachings, taboos, artifacts, all these things that seem to help us get a little advantage on the uncontrollable. In the present day, we are talking about 5 specific religious, spiritual needs. The basic question, does this person uniquely maintain and nurture her own human spirit? The needs are religious support, spiritual validation, spiritual counsel, instruction, and self-forgiveness. First, there is the need to feel, need for an experience of transcendence as positive, close, on my side. Classic example is prayer, either shared or solitary, in which there's an impression that a transcendent being, the divine, is close, right here, and cares about me. There are numberless ways in which people nurture their own human spirit. All kinds of hobbies and volunteer and careers in which people feed their own human spirit by doing things that just seem to bolster their soul. When people start talking about these unique ways in which they nurture their spirit, it's time to listen, because sharing them enhances them. There is spiritual counseling, in which a person tends to mull over things. Questions. 2 kinds of things. Questions like, will I go to hell if I kill myself, if I stop dialysis? Is that suicide? Questions about why. The primary question of religion is why. If there's a good God, is there such evil and bad stuff happening in every room in this hospital and all over the world? And then there are those wounds that have been inflicted by past leaders, organizations that were set up to help us spiritually. The need for relief from guilt or shame is huge. Life is made up of mistakes, and some of those mistakes we're aware that hurt other people, some people we care about. Sometimes they hurt all of society in some way, and we regret them. That becomes a spiritual need that in our society has little place to go, because you can easily be criticized as having a guilt trip. There's something wrong with feeling guilt, but guilt is natural, as pain is to the body, guilt is to our behavior. It's an indicator. It tells us, it pokes at us, it shows us something that wasn't very honorable. And it needs care. And then there is religious instruction. There is a lot of teaching in religions that we've got pieces of during our lives, but when there's a crisis time, we want to remember it and be able to use it better. And there is a spiritual need then for better instruction to augment what we've known and fill in holes and bolster our beliefs. The final axis 4 has to do with advocacy and referral. What does this person need that may be beyond my relationship with her? Ethics, confusion, addiction, mental illness concerns, advocacy, family conflict, and love life pain. Fill out this axis. There's, first of all, is ethics confusion. You need to understand and discuss treatment outcome concerns with someone who's congenial, is honest, open, and knowledgeable about medicine and what exactly is happening and what might be the best thing to do in this situation in which there is no clear best direction. All directions seem to be unacceptable because we're near the limits of what healthcare can do for us. There's a window of possible awareness of concerns about one's mood-altering chemicals or mental health when people are hospitalized, because people that are addicted do not always look like this. They look more like this. Addiction doesn't show. But there's a time in the vulnerability of hospitalization that sometimes people can be brought to greater awareness through focusing on their concerns, because those concerns are there, but they're hidden. People in hospitals who feel neglected because they don't seem to be getting the help that they need, and they don't know how to communicate about that. Advocacy is a frequent need. Finally, conflict, which in healthcare settings can make things worse, can distract, can increase the pain. It's a need and difficult to address, and sometimes necessary to address. And finally, there's love life pain. Person that you really want there at the worst times in your life, and things may not be going that well, because we all struggle at various times intensely with our love lives. And the need here is to have someone listen for advice, to give some advice, maybe wisely only, or refer to counseling about that aspect of life that is so powerful to raise our spirits and lower them. In the process of spiritual care, the first step is rapport, and then identifying patient needs. What is the care functions, or what a spiritual caregiver does when he discovers a patient need, and then expected outcomes are found on the website at spiritualclinician.com. If you'd like a 1 or 2 day workshop on these topics, contact me at one of these numbers.